So someone asked us about Yod Basedow and its cousin. His cousin is called Wolff Chaikoff. And these are systemic iodine reactions. And the reason you need to know it is if you're ordering a CT scan, the contrast material of CT is iodine. And that is that yod, which is an iodine. The dude's name is Basedow. So these three are names of people, but this just means iodine. So when you give exogenous iodine to the thyroid gland, the iodine is uptaken by the gland, and he's going to use that to try iodothyronine T3 or put 4 of these iodines on there. And those are the basis of the hormone. And that's why iodine is an essential part of your diet. In fact, we iodinize salt so you get enough of it. If you give an exogenous iodine load in a CAT scan, because the contrast material is made of iodine, then you might induce a Yod Basedow or a Wolff Chaikoff effect. And that's because the iodine has both a feedback loop on the production of the thyroid hormone, and also the whole job of this thing is to uptake the iodine. So Yod Basedow, if you give iodine to a thyroid patient and they happen to be Graves' disease from hyperthyroidism, that iodine will cause hyperthyroidism and could induce a thyrotoxic storm from iatrogenic exposure to the iodinated contrast. So when we're looking at thyroid eye disease in Graves patients, we actually don't need the iodine because we're just looking for big muscles, yes or no, and we don't need the contrast to see that. So non-contrast orbital CT is probably good enough for thyroid eye disease to answer the question radiographically: do we have enlarged extraocular muscles or not? Do we have compression of the orbital apex or not? And if it's Graves' disease, there's some theoretic risk of inducing a Yod Basedow effect, exogenous iodine causing hyperthyroidism and thyroid emergency or thyrotoxic storm. The reverse effect is the Wolff Chaikoff effect because it has a negative feedback, an inhibitory effect, and so you could get low thyroid from getting an exogenous load. So exogenous iodine can produce a high thyroid or a low thyroid response. These have names: Yod Basedow and Wolff Chaikoff, and you should be worried about the theoretic risk of giving iodinated contrast to an active thyroid disease, but especially Graves' disease, and you don't really need the iodine to look for what we're looking for, which is enlargement of the extraocular muscles in thyroid eye disease.